So you're in pain, maybe you have shoulder pain, ankle pain, back pain. You want to know, should I go see an orthopedist or should I try something more conservative like chiropractic or physical therapy, acupuncture, some sort of conservative treatment first? So this is a very important topic in the healthcare community. In fact, I think it's one of the most important topics presenting to our overall population in today's society. And it's something called portal of entry. So portal of entry is where exactly you enter the healthcare system, okay? I like to use the analogy of a ladder, okay? So the very top of that ladder is surgery, right? So once you have surgery and you've reached the top of that healthcare ladder, you cannot go backwards. You cannot come down that ladder, right? You cannot undo the surgery. So what I always recommend to our patients is try the trial of care with conservative care first. So your portal of entry should be on the lower end of that ladder. And maybe what will happen is you'll get the relief with just a conservative treatment and you'll never reach that threshold of the orthopedic surgeon or things like that. And what's important about finding that right conservative care office is finding somebody who's educated on the current research and guidelines so that they understand when it's appropriate for you to get worked up that ladder. So we have very great relationships with pain management docs, with orthopedists, with neurologists in this area, and we know exactly when our patients aren't progressing like we want them to and when to progress them up that ladder. So find somebody on that conservative end of the spectrum that will kind of work you up if need be, but with the goal of kind of keeping you on the lower end of that ladder as long as possible and trying to avoid the more invasive procedures like painkillers or surgery or things like that. Hope that answered your questions, and feel free to give us a follow and reach out with any questions. Thanks, guys.